Okay, I think that what I want to do is it's 12:03. I want to go ahead and get started. And for those who've joined right at the beginning, I'm going to do a 20 minute or so chat about what I consider pre-diabetes. This course will be a three-part series, and it will be one session per week. And if you miss one, it's okay because I will put them up so you can view the video later. But I will tell you that it's good to attend them because you'll have a chance at Q&A at the end. If we have no questions, that's fine. But if we have questions, then that's your chance. This class will also be beneficial for anyone, as I get into this, that is maybe looking for weight loss, has been told they might be a pre-diabetic. It would be helpful for a diabetic as well, or anyone interested in helping family members that might have issues along this line. So without further ado, I'll go ahead and get started. I'm Dr. William Curtis. For those of you who don't know me, I'm a medical director at Future Focus Family Medicine. I've had many years of practice as a primary care physician where in a community that is very, very dense with type 2 diabetics and lots of people on their way to type 2 diabetes. So this is a hugely important topic for this community, and honestly, worldwide, it's a huge topic. For those of recently with the whole COVID-19 situation, it's also been shown to be very important because what they're finding is that COVID-19 is not particularly dangerous to folks that don't have any significant medical issues. It is attacking people that have advanced age, and it is also attacking people with signs of diabetes or full-blown diabetes. That's a high-risk category. So not to scare anyone that in a sense that if you were to get COVID-19, you have diabetes or pre-diabetes, you're not doomed, but it's just one of those populations that if we really, really drill the numbers down to who's at risk, folks with what we consider metabolic disease are at risk. So this is an important topic right now, and it was an important topic before COVID-19 came along. Hang on one second, I got a cord tangled here that's killing me. There we go. Okay, that wasn't going to last long. Okay, so without further ado, let's start talking about what is prediabetes. Prediabetes is a collection of what we call metabolic symptoms. Metabolism is how your body processes energy. And this includes bodily changes and also lab changes that we see in your blood work that are on a scale that progress towards type 2 diabetes. Now, everyone knows with type 2 diabetes, there's, sugar is involved, and, high sugar is a problem. But there is a collection of things that go on well before a person becomes a type 2 diabetic. I think in the show notes, I'll also put a link to a video I did a couple of years ago with my wife, who's a nutritionist and a chef. We did a whole topic on the progression of type 2 diabetes, and it has a pretty long section on this, but I'm going to cover it briefly today. So things you might see if you were looking at a human being walking along in the mall or something, and you wondered, I wonder if that person is on the scale of diabetes. I wonder if they're progressing towards diabetes. The first thing you would look for is, do they look overweight, or they have a complaint of gaining weight? Okay, gaining weight is a sign of progression towards prediabetes or even full-blown diabetes. If you see a pooch in the belly area, so down around your belly button, if you tend to put on weight in that area, you're moving towards type 2 diabetes, and that is a sign of metabolic disease or insulin resistance. If your energy is low, if you have high cholesterol, if your doctor's told you have high triglycerides, these are all also symptoms in the progression towards type 2 diabetes. If you've ever been told you have a fatty liver, that's not really a derogatory term, but it's a sign that the liver has these fatty streaks mixed into it, and it's a sign of progression towards type 2 diabetes. If you have been diagnosed with obesity, which is, a BMI greater than 30 is the real cutoff. There, you can be overweight prior to that, but obesity starts getting labeled at a BMI of about 30. If you have been told your blood sugars are higher than they should be, that's another sign that you might be very close to developing type 2 diabetes, because the body's starting to lose its ability to control sugar day to day. If your average fasting sugar goes above 126, so say you haven't eaten for 12 hours, you stick your finger, it's greater than 126. This would be, if it consistently is that way, that would be a sign of diabetes as well. And there is a test called a hemoglobin A1c. In my Killing Diabetes course, where we talk about how to reverse type 2 diabetes, I go into great detail in all these labs. But what the A1c is it's an average blood sugar over the last 3 months. It's actually a scale that correlates with blood sugar. So the higher your average blood sugar goes, the higher your average hemoglobin A1c. A pre-diabetic is usually in most labs, between about 5.7 and 6.5. If you go above 6.5, you're considered a type 2 diabetic. So in this situation, a person with pre-diabetes has a tendency towards weight gain, high triglycerides, maybe a fatty liver. They might have been diagnosed with obesity. They also tend to develop hypertension. That is something that we often see, is the development of hypertension or high blood pressure, okay? So the question you should be asking yourself is, okay, what happens as, the body is progressing towards pre-diabetes? Well, there's damage that's going on. It's not normal to have this situation where you're developing this end organ stuff. And as I go through this, I'm going to explain kind of why that's happening to some extent. Fatty liver in particular is one of the major milestones that I look for a person that's developing diabetes, because it's one of the features that if we go looking for it, and sometimes we see it on abnormal liver tests, but when we see people with fatty liver, it means they're well on the progression, the pathway towards diabetes. In fact, most people have weight gain in their midsection, high triglycerides, and a fatty liver 10 to 15 years before they're diagnosed with type 2 diabetes. So it's something that's there a long time before they have diabetes. So it's not something you want to wait, like, oh, thank goodness, I only have pre-diabetes. I don't, it's important that you know that now. And at our clinic, and certainly in my practice, I'm very urgent with patients about, no, this needs to change now. This needs to change now because of the long-term consequences. And I'm going to talk about some of those, including inflammation, near the end of this short talk. The other thing that happens when you have a fatty liver that is not often discussed by doctors, but is in part of the pre-diabetic stage, is the pancreas itself also develops fatty streaks in it. And there's an interplay that I won't go into in great detail today, but there's an interplay between the hormones in your body, liver, sugar, and pancreas. And what happens is the longer your insulin and sugar levels are very high, what ends up happening is it actually damages the pancreas. The pancreas cannot make insulin, which is a hormone we're going to talk about here briefly. And when you can't make insulin, it's sort of, that's why you start to spiral off where you can't control your blood sugars, okay? So I won't give too much more detail about that right now, other than to explain that, there's an interplay of hormones that lead to damage of these organs. So there is damage that goes on even in the pre-diabetic phase. Fortunately, as you'll hear me talk both in this talk and in others, I believe that this is completely reversible for the vast majority of people, including people that have full-blown diabetes. If I can manage it, I'm going to post a poll here for those of you to answer. And the first one is up, and the question is, what is the most important problem related to type 2 or to diabetes? I'm going to just post that and let you guys answer that as you feel like it, okay? And I will kind of give my 2 cents on that. So I'll give you a couple minutes to do that. But click, if you see the poll there, great, answer it. And I will give my 2 cents. So we've got a few people answering here. Got 2. Everyone's still viewing that. Okay, so everyone that is able to vote has voted. Looks like our predominant answers are high blood sugar. So what's the most important problem related to diabetes? The first answer, some people answered, about a third of you answered high blood sugar, and a third answered obesity. Okay, that is awesome. We'll end it right there. So the predominant answer was obesity. So let's go ahead and answer that question. So as far as I'm concerned, the most important problem related to diabetes or the development of diabetes is actually insulin. Insulin is a hormone made by the pancreas that has a cascade of effects in the human body. But one of the main things that it does is it causes us to store sugar in the form of fat. Okay, so it is a hormone that's predominant job is to help us get energy in the form of sugar out of our bloodstream and put it into the cells of our body. If our cells in our body have enough energy, then it gets stored as fat. So the hormone we call insulin is a fat storage hormone, and it is driven primarily by the consumption of sugar or starchy-based foods. Now, some people will say, well, protein can make insulin go up a little bit and things like that. Yes, there's some details, and we will get into that in later talks. And I covered in massive detail in the Killing Diabetes program. But in this section, I'm going to tell you that insulin stores fat. Insulin is the reason people get belly fat in their midsection. Insulin is the hormone that triggers this changes in the liver. We call it fatty liver. It is also the change. It also changes the pancreas. So it is a negative to have insulin in the body. There's another major reason this is a negative. It causes the development of inflammation. A lot of times people hear about diabetes and they know things, oh, it's sort of bad for my eyes, it's bad for my kidneys, I might get dialysis, I could end up with heart disease. Those things are all true, but the common denominator is inflammation. And inflammation is the common pathway that for all these diseases, in particular heart disease. When people ask, what's the cause of heart disease? I always answer inflammation. Inflammation is triggered in many ways by insulin being unbalanced. It's like an unbalanced hormone. I guess some of you have probably heard of people like that take testosterone and they take too much and they get roid rage or whatever, right? They got way unbalanced hormone. Yeah, you can take too much of any hormone and you can have problems with your end organs. The same thing goes for insulin. And when you see people walk around that are overweight or have the symptoms we described in prediabetes, this is a sign of a hormone imbalance called insulin. Now, there are some other details that go along with that, but insulin is the problem. I'm not going to go into it today, but some of the sharper ones in this room I know should be asking, what about people who have diabetes that are on insulin? Yeah, good question. Does it help them or hurt them? You'll have to take the diabetic version of this to get that answer today. But the risk of heart disease and heart attacks, this is extremely important that you hear this. The risk of a heart attack, which is the number one cause of death in this country, not COVID-19, it's heart disease, which is the number one reason for that is diabetes and metabolic disease and prediabetes. Okay, so the number one killer in this country that outshadows all other causes of death is heart disease. Okay. The risk factor for developing heart disease is the same for a pre-diabetic as it is for a full-blown diabetic. This is why the urgency. This is why it matters. I have people that aren't quite diabetics, but are morbidly overweight and already have symptoms of diabetes like neuropathy in their feet, numbness, high blood pressure, high triglycerides. They're already developing all these symptoms 12 to 15 years before some doctor walks in and says, oh, by the way, you have diabetes because your sugar's high. No, 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 no. You had this all along. It was there for years prior to this. And that's why we want to educate everyone about pre-diabetes, okay? So heart disease risk is the same as a full-blown diabetic. Now, obviously, it's worse if you're full-blown diabetic, but it's certainly a pre-diabetic is at risk. So the next thing I want to talk about is, and I put these in question format, so I'm kind of going through the questions that I was going to cover in this session. The first one is diabetes or pre-diabetes, is it genetic or is it environmental? I think this is a really powerful question because I see a lot of people that sort of get stumped by this and they think, well, mom and dad had it, so I'm going to have it. All my sisters have it. My brother has it, so I'm going to get it. The answer is that there is a genetic tendency. Let me explain. There's a thing called epigenetics. It's a field of study now in the world that we know that, you know, there's genetics can be very black or white. Like I have blue eyes, you have brown eyes, okay? That's a genetic trait that is very, one gene says you're gonna have blue eyes, you're gonna have brown eyes, right? Very simple, but that's the case. Epigenetic studies teach us that we can change the expression of what our body looks like and that how our body behaves and the diseases we develop based on the environment we place the body in. Now, environment can be food, pain, injuries, accidents, chemicals, smoking, drugs, medications, anything that we ingest or externally experience. And even exercise is an external environmental influence, right? The real answer to the question is that we're learning that it's kind of like when we were kids, they had those choose your own adventure books, where you could go in and you could say, well, the vampire's chasing me. I choose to run away. Okay, go to page 23. And then there's a different story that finishes up, right? That's how epigenetics are.
Mm-hmm.
We now know that it's not black or white. You have diabetes, therefore you're going to have diabetes. No, you have a genetic tendency towards diabetes, some more than others. But the environment, the way that the body is treated, both nutritionally, lifestyle-wise, activities, experiences, smoking, all these kind of things, that is actually what determines whether a person will develop full-on symptoms of type 2 diabetes. Some people have to work harder than others to offset that based on their environment and their genetics. So the answer to this question is yes, it's both. It's a genetic tendency, but the saving grace for most of us is that you can change your genetic outcome, your what they call physiologic phenotype, what you look like, how your body behaves, the diseases you develop based on what you do. Okay? If you do the same thing mom and dad did, and your brothers and sister did, if you're inactive, don't eat the right foods, and that we will go into in other sessions, then you will develop type 2 diabetes, most certainly, if you have a strong family history. And then you will have those things. Here's another interesting thing. Well, I'm skinny, and I don't have type 2 diabetes. My parents aren't diabetics. Does that mean you could not be a diabetic? No. If you have a bad enough lifestyle, you can have no genetics for diabetes and still develop it. The other interesting thing about epigenetics, have you ever seen skinny people or people that don't have diabetes and they're like, man, they can eat anything they want and they don't have diabetes. Why I eat, if I look at a potato chip, I'm going to get, diabetes, right? There's people like that. Let me explain how epigenetics works. If I have a mild family history of diabetes. If I ate a full-on bad diet all the time, was inactive, I would probably develop type 2 diabetes. I know patients that could eat the same bad diet. They would not get diabetes ever, but they might get cancer. They might get an autoimmune disorder, which is a whole nother topic. We could do a whole nother session like this on autoimmunity, which we'll probably do at some point in the future. But depending on their genetics, they eat the same bad things. Instead of diabetes, the manifestation of diabetes, they might get an autoimmune disorder. So it's the same for everyone. It's not, nobody gets a pass on this, okay? Everyone has to try to do the best they can to feed and fuel their body properly. And in later sessions, I will go into that. So that was, it's very powerful to know that it's not just genetic, it's environment. And I think it's probably 80-20 environment to genetics. What about this obesity epidemic? We all hear about it. Everybody's talking about it now, and it came up a lot with the COVID-19 stuff because we found out that folks that are overweight and have diabetes were the ones getting really sick from this condition. And what about the kids? I'm going to get up on a soapbox for just a couple of minutes here. If you want to hear more about a discussion like this, the WFO Live podcast, of which there's a tribe inside the network that you got into to watch this, there is a episode with Dr. Rick Cortez, who's a good friend of mine, and he's a pediatrician, that we talked about childhood obesity. I am very passionate about this because it is a terrible problem in this country, in the world generally. We are feeding our kids a diet, and they are that is highly processed with chemicals, pesticides, artificial sweeteners, and addicting foods. I'm giving them a pass by calling what they're some of the things we're eating food. And what's happening is we're seeing a generation now of children who are morbidly obese and have prediabetes before they're 12 years of age. And these kids are going to have heart problems, and they're going to have advanced signs and symptoms of diabetes before they're 25 to 30 years old. This is a terrible problem, and it's reversible. But we have to look at this as a familial, generational problem that must be challenged head on with diet and lifestyle, which we will cover in this talk or in this class. We must combat the messaging of corrupt food industries and the messaging that the cultural norm that's like, hey, whatever, it's okay if I'm inactive, it's okay if I eat whatever. It's not okay. And I have never heard government officials coming forward and saying, you know, we're gonna call it child abuse if kids are eating the wrong foods or the morbidly obese, things like that. But I know in other countries, I know the United Kingdom is talking about doing something along those lines. They're starting to make
Wow.
it a criminal situation to see children massively overweight and things like that, because the problem is it's leading to disease down the road. So this is a big deal for me. And I think as a family, I think we should be striving to be active, have, experiences in life, not what we can consume, have high quality food. We demand it of ourselves that we have high quality food. Our mealtime should be a sacred time where we eat together and communicate and, share our day. We should prepare our own food. We should eat out less. A lot of us have done this during the COVID-19. It's not such an unpleasant thing. I would, I have found that it's great having meals with my kids and my wife every day, and not scattering it out and eating on the run. It's not good for people to do that. I have also found a lot of people that I've counseled have been eating their own food. They've been making their own food. They've been growing in gardens, and I'm always posting things about my garden. And I just think it's a great hobby, and it's a way to secure your family. Who the hell wants to be like in line at HEB, right? Who wants to be waiting to get something? Can I get some fresh vegetables? Oh, they're out of it. Well, it's not hard to grow it in your backyard. It's not hard to grow it in a basket or in a pot. So these are the things I'm encouraging families to learn these skills, teach each other these skills, and ultimately look at our children and say it's not acceptable to eat and consume things that lead to pre-diabetes and diabetes. And I'm going to go into that in great detail in the next section. The last thing I want to go into is, and we'll wrap this up, and I'm going to allow for a few questions for this session, but I wanted to respect your time during the lunch hour here. Insulin. We talked about it early on, how it leads to inflammation. It's the hormone that causes fat storage. I want you to know in this session what triggers insulin release. The main thing is carbohydrates. A carbohydrate is a simple sugar. And the biggest offenders are hardcore sugars and processed sugars, such as Coca-Cola, sodas of all types, cakes, pastries, pan dulces, sweet tea, fruit juice, candy, cookies, anything that has sugar, high fructose corn syrup, or artificial sweeteners in it is a problem. Okay? These directly drive insulin straight up. And you remember, it's an unbalanced hormone, and it does weird things to our body, like make us gain weight in our midsection, store fat in our liver, fatty liver, diabetes, blah, blah, blah. All right? So these are the hardcore ones. Now, I will get into, in the next section, more in deeper detail about nutrition for diabetes and pre-diabetes. But in this session, I want you to be focused on the hardcore stuff, the stuff that is not your friend, the stuff that human beings were never designed to eat in any significant quantity. The other thing about this is you say, but I like those things. And oh, by the way, beer and alcohol fall into that category. Predominantly beer, because it has higher carbohydrate amount in it, but those foods fall into this as well. But one thing I want you to know about these foods, we like them, we crave them. I like the taste of something sugary. I love it. The reason is we're all genetically programmed to want easy, quick energy. We were cavemen at some point in our history, our ancestors were, and food was scarce. It was not unusual for a person to go days without eating anything, weeks. We're designed that way. Can't do without water, but we can do without food for a very long time. Okay? But sugar is a quick energy. As soon as you take it, boom, the body gets a little surge of energy. It's quick, it's fast. Insulin makes it get into our cells really fast. So we crave it. Okay? And I'll talk about that in greater detail. So don't feel like you're like, something wrong with me. I'm weak. Or, I hear all this. I hear the language I'm using is people that tell me these things. I'm weak. I don't have any willpower. Every time I see a candy bar, I have to eat it. It doesn't mean you're weak. There's nothing wrong with you. You're built this way. But there are tools and strategies. And the more you eat it, just like a, crack, cocaine, the more you eat it, you're going to want more of it. So it is an addictive thing. And the companies, and remember I said the corrupt food industries, I don't know if you know this, there are scientists, their entire job in the world is to develop foods that are addicting. Salty, ever tasted that thing that's just the right amount of salt, just the right amount of crispy, just the right amount of sugar, not too much, not too little. They actually have a sweet spot that these, when they make a product, it gets tested, thousands of different variations of it with slight different ingredients in it, trying to make it hit the palate, the sweet spot in testing with, you know, the lemons that go out and do these kind of tests. That's what happens when you open a package of something and you start chipping on it. You realize it is prepared. It was chemically prepared. If you don't know this, go watch Food Inc. or there's all kinds of references. Ask me later in the comment section or something, and I'll tell you some other references. You can go look this up. Food Inc. pops into my head for some reason. But food is being crafted to hook your children and yourselves into eating things that we were never designed to eat. Yes, it's addicting. Yes, it requires consciously trying to avoid it. So that sounds like I think I stayed on the soapbox for quite a while there. So I'll come down off of that. But you can tell I get very passionate about that because it's a real problem and we're being shoved things. And like when you leave the grocery store, and I won't name the major chain that I shop at every day, but when you leave, there's a gauntlet of sugar and boxes and crates of sugar and junk you have to walk through, and your children have to, you know, go past as they, you know, and those are all, they're selling us that. They're selling us the junk right there that is addicting, that is difficult for us to pass and walk past. So be aware of that. Before I go to questions, I have a challenge for everyone. I encourage you to do this until we speak again. First thing, challenge number one for this week, until our next visit, no liquid sugar at all. We just talked about what it does to us. I'm talking about no sweet tea, no sodas. I'm not going to go into it today, but no artificial sweeteners. That includes diet sodas. Do not drink them. If you Jones for them, it'll go away, but stay away from them, okay? You will feel better after a few days if you drink a lot of these. No soda, no fruit juice, no orange juice, no apple juice, no cranberry juice. It's not good for your kids either. Apple juice and orange juice have a higher sugar content than Coca-Cola does. It's not health food. Okay? Second major challenge. Share this class with someone that you think might benefit. You've already heard the first message. More people need this. That's why I'm recording it. I treat 80% of the people that walk through my door in my clinic need this talk. They need to hear this. So if you know people, share this talk with them. Share this class with them. Have them show up and ask their questions next week, because they're going to have a chance to watch this video, and then they're going to hear the next one that's going to come on the full double barrel nutrition talk for how to reverse, you know, weight loss and prediabetes and all that. So share this video, share this topic. Also, share your progress. There is an activity there in the activity section of this class, the prediabetes class. There is a section there. If you decide you have a question 3 or 4 days from now and you want to pop it in there, put it in there. If you have a comment like I'm struggling with something, pop it in there. I will monitor those, as will my other host, Melissa and others. We will monitor that. I will answer those questions as best I can. This is a live course for the next 3 weeks. Okay? So as I see those, as I have time, I will answer them in my busy schedule, and I will even show other resources. So be a person who asks questions, shares their experiences, and share this with other people, okay? So that's in the little chat area that you'll see when you look inside the class deal there. I will be posting before next week. Next Wednesday will be the next class. In that class, I will specifically go through nutrition in great detail. But you have your first challenge, and I'm gonna leave this for a few minutes to questions. If you have questions, now's the time. I don't know if these get texted over or if you want to unmute and ask them. That's okay with me too. So I'll just hang on for a sec there and hold up. And if Melissa, I don't know if you see where the questions come through or if people want to ask verbally, but either way works.
I had a question.
Okay. You have the floor,
what's the difference between the insulin resistance and actually having the diabetes? Like what is insulin resistant? mean?
Yeah, so that's a good question. Insulin resistance is the term that we use. It's really what we're talking about right now. It's pre-diabetes. Insulin becomes resistant. Insulin works like a lock and a key. So if you're trying to get sugar into the cells of your body, you need something to get it across into the cell. Part of the way you do that is with this lock and key. Insulin serves as the key. What happens is, remember I told you the pancreas and the liver become damaged over time by insulin? What happens is that key gets to where it doesn't fit right anymore. So the sugar starts to back up, and your body says, I can't get enough sugar out of the bloodstream into those cells. So what it does is it starts telling the pancreas, make more insulin. We need more. And the higher the insulin goes, okay, now the sugar can get in. But remember what we said, if you have high insulin, you're gaining weight in your midsection. You're damaging your pancreas. You're damaging your liver. So what's happening over time is it's like this vicious negative cycle going on. It's slowly requiring more and more and more insulin just so that you can get the same sugar back into your cells. Ironically, at some point your body says, I can't do this anymore. And you know what, then your doctor that's been monitoring you for 10 years walks in and goes, oh, look, your sugar's high, you're diabetic. And that's why I mentioned earlier, no, you've had the condition for 10 years. It's been there for 10 years. We just ignored it or didn't identify it, the metabolic disease and the insulin resistance problem you're talking about. Really, insulin resistance is part of this whole process we're talking about. It's just another label for one of the chemical hormonal event that's going on.
Okay.
I hope that answers your question.
Yeah.
What else? It's a great question. Okay.
I'm sorry.
Go ahead.
I had a lady that was showing us Nathan's Omnipod, show me her Omnipod, and she said, well, I'm a type 2 diabetic. And as you know, type 2 diabetics eventually will need the insulin. And I was thinking, like, you can reverse that if you just change your diet. But she kind of argued with me and said, no, that's not true. Eventually you need insulin.
Right. So, yeah, there's a question there. So in this course, we're talking about the lead up to diabetes. But I'm going to jump ahead. I have an entire online course called Killing Diabetes. That is designed to reverse type 2 diabetes. Can every single type 2 diabetic on the planet be reversed? Probably not, because there is some damage that goes on for some diabetics at the level of the pancreas where their pancreas stops making insulin, and then they act like a type 2 diabetic or type 1 diabetic where they need insulin. So there is a situation where that can occur. I'm going to tell you, my clinical experience is that the vast majority of people, and I can tell you, I've had people on hundreds of units of insulin already that are reverse their diabetes to non-diabetic ranges without insulin. They do so by specific steps that we'll go through part of those in the lead up here. But to answer your question, there are doctors, and I'm a medical doctor. I got an MD behind my name. I was trained in a medical school just like everyone else, where they say diabetes is not curable. It's genetic. I'm going to tell you that the vast majority of those that are that cut in stone, they think it's just all you can do is give insulin. They're just wrong. They're just wrong. I can only tell you what my clinical experience is. I'm not saying they're bad doctors. I'm not saying that they were not trained properly. I'm just telling you that if I've done this, let's call it hundreds of times with patients, if I've already done this and I've seen that people with advanced disease can reverse where they don't require insulin, they don't require medications, they eat right, they exercise, and they have that dialed in, they realize that they just have to change their environment, both food, exercise, fitness, everything. If they do that, then they don't have this condition. I don't know what you call that. Do you call that cure? Do you call it remission?
I would say so.
I mean, there's lots of ways you could call it, right? I believe that for the vast majority of people certainly with pre-diabetes, this is slam dunk. If you have pre-diabetes, you're not diabetic, you're just overweight, please solve this issue. Follow the rest of this class and and solve this issue. If you have diabetes, you're on medications, even insulin, I'm just throwing out there that I'm not the only doctor. This is not, one doctor on an island, even though it looks like I'm on an island. It's not one doctor on an island that's decided that I'm going to just claim that diabetes is reversible. There's a legion of other doctors that are saying the same thing. There's entire books written on this topic. It's out there. It's reversible. If somebody's stuck in the idea that they think, oh, the only way I can do is focus on my sugar, focus on my sugar. Sugar is not the disease of diabetes. Insulin is. Sugar is like treating, say you have the flu, say you have COVID-19. It's a virus, right? And you got this antiviral medicine, hypothetically, because we don't. But if you did, wouldn't it make sense to give that medicine that kills the virus instead of treating the fever? Doesn't that make more sense? Treating sugar is like treating the fever. Treating insulin resistance and insulin is like giving the medicine that kills the virus. Okay? Hope that makes sense.
Yeah. Thank you.
We're in our final few minutes here. Any other questions? You've had 2 great questions from Vanessa. And remember, if you kind of want to let this soak in, because sometimes I know these kind of talks can be like roller coaster. I hit everyone with the whole insulin's actually the disease, not sugar. So that takes a while to soak in anyway. If you do develop those questions, you know where to go. You're going to go to the chat section of this class. It's going to be live for the next 3 weeks. And I hope you will ask questions to your heart's content there. If I don't have any further questions right now, then I will do just that. I will leave this up to you to ask questions in the chat section. I may add a couple of links I talked about when I listened to this again. I think I mentioned the Killing Diabetes program. I'll throw it out there. I think I mentioned a couple of other links and stuff, maybe a link to the talk that Dr. Sullivan did. And I think there was one more we talked about in there. I'll go back and listen to it. And I'll add in a couple of other topics on inflammation and things like that we talked about, okay? And so you'll have like this other material that you can look at over the next, week, okay? All right, well, then I'm gonna sign off for there. Melissa, thank you for your help. Thank everyone for attending. Again, you have your action item, your challenge for this week, which was no liquid sugars. And we also said, let's share this class with others. And if you have questions, get into that chat section and ask those questions. Until then, I will talk to you guys later. Take care.
Bye.